Now, in the fourth section of our lecture, we will talk about some benign neoplasm that can affect the salivary glands of the body. So, the common benign neoplasm which we will discuss in this section will be the pleomorphic adenoma, adenolymphoma and oncocytoma, and also hematogenous and hemangiomas and lymphangiomas. So first, the tumors of the salivary glands. We have the benign neoplasm, which we will talk in this section, and then we have malignant neoplasm also, and then the benign neoplasm are of epithelial origin or mesenchymal origin. Similarly, with the malignant neoplasm, they will be of epithelial origin and mesenchymal origin. So the epithelial tumors are the pleomorphic adenoma. Then we have adenolymphoma or the Warthin tumor, oncocytoma, and some other adenomas also. So epithelial benign tumors of the salivary glands are pleomorphic adenoma, adenolymphoma, and oncocytoma. Mesenchymal are the hemangiomas, lymphangiomas, lipoma, and neurofibroma. Then the malignant neoplasms, which are from the epithelial cells, are mucoepidermoid carcinoma, which may be low grade and high grade, adenoid cystic carcinoma, acinic cell carcinoma, adenocarcinoma, malignant mixed tumor, squamous cell carcinoma, and also undifferentiated carcinoma. All these are the malignant tumors that arise from the epithelial cells. And then the mesenchymal will be lymphoma and sarcoma. So let's begin. In this section, we will talk about the benign tumors. So let's talk about them one by one. So pleomorphic adenoma. Pleomorphic adenoma is the most common benign tumor of the salivary glands. Pleomorphic adenoma. Very, very bad picture you can see. And then there is from the parotid, submandibular, or other minor glands. So pleomorphic adenoma is the most common benign tumor, can involve parotid, submandibular, and also minor salivary gland, which are lot in number. Slow growing, it's a mixed tumor and it's a slow growing tumor. Mucoid, fibroid, vascular, mixochondroid, or chondroid. So stroma can be all these different types of the structures or tissues are involved. It's a mixed type, slow growing, and there are in the stroma we have mucoid, fibroid, vascular, mixochondroid, or chondroid tissues present. Encapsulated and send pseudopods. Encapsulated, it's covered in the capsule and it sends the pseudopods, mean it sends the finger, or you can see the attachments, pseudopods, to cause us infiltrate the other structure. So encapsulated and sends pseudopods. Surgical excision and superficial paroidectomy is the treatment of the pleomorphic adenoma. It's encapsulated and it has pseudopods. Then the other is adenolymphoma and oncocytoma. Adenolymphoma is predominance in the males. Ratio is 5:1. So if 5 males are affected, 1 female is affected. So adenolymphoma is more common in the males. from tail of parotid, and it's bilateral in 10% of the cases. So adenolymphoma is bilateral in 10% and it's also developed from the tail of the parotid gland. It multiple, rounded and encapsulated. Cystic with mucoid. So this adenolymphoma is a cystic tumor. This mucoid cystic, and it has a soft cystic structure with fluid in it, or it's with the mucus in it. So mucoid, encapsulated structure. Superficial parotidectomy is the treatment for the adenolymphoma also. Then we have oncocytoma, is from the oncocytes in elderly. Superficial lobe of parotid gland is involved. Remember, the adenolymphoma is from the tail of the parotid gland, and this is from the superficial lobe of the parotid gland. Increased uptake of technetium-99. Superficial parotidectomy is the treatment. So two other benign tumors is adenolymphoma, oncocytoma. Adenolymphoma developed from the tail of the parotid gland. It is encapsulated, rounded, cystic structure with mucoid. And then we have superficial parotidectomy is the treatment. As compared, the oncocytoma developed from oncocytes is common in elderly, and superficial lobe of the parotid gland is mainly involved. Then we have hemangiomas and lymphangiomas. Hemangiomas, they are most common in the females. Cutaneous hemangioma in 50% of the cases, the skin is involved, it's in the skin, that's the cutaneous hemangiomas. Soft and painless bluish discoloration. Surgical excision is the treatment. Then we have lymphangiomas, less common in parotid and submandibular gland, soft and cystic, no regression. Lipoma and neurofibroma are rare. So we have another benign tumors. Remember, they develop from mesenchymal cells. We have hemangiomas and lymphangiomas. Hemangiomas mainly involved are the cutaneous type, and they involve the skin, and it's more common in females, and in 50% it's cutaneous hemangioma. It's soft and painless bluish discoloration. Surgical excision is performed. And lymphangiomas, again, they are soft and cystic, no regression. They are less common as compared to the hemangioma, and when they occur, they involve parotid and submandibular glands. Also, treatment is by the surgical excision of hemangiomas and lymphangiomas. So as we saw, they are mostly encapsulated type of tumors. So when it's encapsulated, more localized type of lesion, then the excision is the treatment of the choice. Surgical removal of the tumor is done. So that was all about section 4. Thank you for watching sqadia.com.